I'm Angela Val. I'm the Executive Director of Ready.Set.Philly. And today with me in Sister Cities Park is Dr. Bettigole. She is the Acting Health Commissioner for the City of Philadelphia. Thanks so much for being with us today. I really appreciate you spending the time.
Oh, it's a pleasure to be here.
So I know that Philadelphia has one of the highest vaccination rates in the country. That's really exciting, something to celebrate, so congratulations on that. But what can we do to make sure we get past that finish line in the next few months?
So yeah, we are very excited about the high rate of vaccination in Philadelphia and how far we've gotten. And that's really something to just take a moment and celebrate. It's been a lot of work by a lot of people, and Philly really coming together to do this. And then we can't stop there, obviously. We need to reach everybody in Philadelphia. So there's a lot of work. You know, we've kind of moved from the time of mass vaccine clinics and people lining up and, you know, really coming to us, to a time where we need to bring vaccines to people. And we need to go to neighborhoods where people are and think about other ways to meet people where they are. Evening appointments, weekends, trusted partners who we work with. So there's a lot of much smaller scale vaccine providers in the works. And then things like we have a home vaccine program to reach people who may not be able to go out. So lots of different things in the work and incentives. You've probably heard about the Philly Vax Sweepstakes.
Yes, very exciting.
Yes, we have our first couple of winners who we'll be announcing soon, and drawings over the next few weeks. So, you know, really there hasn't been a better time to get vaccinated. More than 250 sites in the city. So really you can get vaccinated where and when you are able to.
That's great. And it's great to know that the numbers of vaccines are going up, especially as we hear about more variants that are coming out, especially the Delta variant. What can we do moving forward to make sure that we're protected over the next several months?
So the good news about the Delta variant, and you're right that it is worrisome, but the good news is that people who are fully vaccinated seem to be well protected. So we really just want to get everybody to that fully vaccinated place. So what we've seen with Delta so far, it's been labeled a variant of concern because it seems to be more infectious and maybe to put more people in the hospital, to be more serious. So those things together obviously are quite concerning. But because the vaccines work, we have a weapon in hand to fight that off. So, you know, first thing, absolutely, anybody who's not vaccinated yet, get your shot. And the people who've been waiting to follow up, they missed their second shot appointment, they're not sure what to do, phila.gov/COVID, there's instructions about what to do, and go and get that second shot. The basic message is you can get that second shot at pretty much any vaccine site in the city. Pharmacies all over the city will do it. The city vaccine sites are partners at Penn and at Einstein.
That's great. Now I know children under the age of 12 still can't get the vaccine. What should they be doing right now so their parents can protect them?
Sure. So children under 12, as you're saying, can't get vaccinated yet, and it's going to be at least fall before they're able to do that. So for anybody who's unvaccinated, they should still be following precautions. But still, you want to be careful. If you're in a public place inside, that mask goes on. And for little kids, if they're playing in a playground and there's a lot of kids around, they should still be masked because they're otherwise not protected.
So you've recently been appointed the Acting Health Commissioner. Can you tell me what your priorities are over the next 6 months?
Sure, and I should say I don't know how long I'll be in this role, so it's my priorities for however long I'm doing this. But first and foremost, the pandemic. You know, really ending the pandemic to the extent that we can here in Philadelphia, and doing that, paying attention to especially our Black and our brown residents who have been most impacted. So that's absolutely number one. And then taking what we've learned from this pandemic and looking again and redoing our preparedness plans with an equity lens. Because, you know, we know, and we really know this now on a gut level, that any public health emergency is going to hit our Black and our brown citizens and residents the hardest. And we have to have that as the center of our preparedness documents. And I'm also including, as I think about preparedness with our team, primary care access. Because we know that there are lots of people in our city who still don't have a primary care provider, and thinking through how we can change that is a part of preparedness planning. And then thirdly, you know, the other pandemic, gun violence, and taking a public health approach to gun violence, seeing what we can do as a health department to try to help that crisis.
Before we finish, you can't leave without telling us some of your favorite things about Philadelphia. So we're going to go through a rapid five, and we're gonna get started right now. First, mascot.
Gritty, of course.
Landmark.
Sanctuary City Sanctuary Neighborhood mural, which is 5th and Huntington,
Nice.
which I love.
Nice. Key state.
Hip City Veg,
Hip
which
City
does
Veg.
deliver.
Nice. All right, I have to check them out. Park.
The Wissahickon.
Ah, very nice. Dr. Bettigole, I want to thank you for joining us today. Thank you for all the work you have done and your staff. We appreciate you keeping Philadelphia safe and healthy.
Well, thank you so much. It's been really a pleasure to talk with you.